Hi, I'm Aarón from Blueprint, and we are developing a standalone and off-the-shelf implant for the regeneration of bone fractures and defects that cannot heal naturally. And with this, we provide the most effective and more efficient solution because we don't need to add any kind of cells, tissues, or growth factors. Our team originates in Charité. We come from many years of research to BMBF-funded projects. And here our focus was to take advantage of structure and mechanics to influence cell behavior and induce regeneration. That led to the development of a technology that eventually make us change from a purely research-based to a translational aim. And now in the team we have not only research competence, but also we have engineering, we have business development and medical competences to try to make the new standard of care for bone regeneration. Well, when you break a bone, the current solution is to take a biomaterial or allograft and combine it with bone that is being harvested from a healthy area of your body. That does not work in 20% of the cases. That requires multiple reinterventions. And the patients that go under this surgery suffer from pain and complications even 2 years after intervention. And we provide a faster solution as we do not need to harvest any kind of tissue, and we are saving all this time also at the operation theater. Our solution is a standalone and off-the-shelf. This means we do not need to harvest any kind of bone, and we reduce up to 30% the intervention time. And also we save a lot of the material that are required for the harvesting of the bone. This together basically means that we rely purely on the biomaterial to do the work, but since we are mostly based on a structure and a stiffness, we don't have the safety concerns and risk concerns of the growth factors on cells that are associated with the other solutions. Still today, 7 million people suffer from bone fractures and defects that do not heal naturally. Current solutions are not efficient enough, and new solutions that are being developed combine cells, growth factors, or combinations of such that are very hard to control. Thanks to our extensive research, we have developed a purely biomaterial approach that is bioactive and therefore set us ahead of the competition to make the new standard of care for bone regeneration.